Medicare Advantage plans are seeing another year of benefit pullback all over the country. And in this video, I'm going to go over 5 benefits that we're seeing pull back and be reduced in 2026. Hi, I'm Christian Brindle, co-owner of Everything Senior Insurance, formerly known as Christian Brindle Insurance Services. We are a Medicare specialized agency that works with seniors all over the country, 46 states to be exact. We don't charge anything for our services, and we work with a multitude of different insurance companies to help people find the best fit based on their needs and preferences. And we are seeing a second year. Maybe you followed us last open enrollment where we talked about how Medicare Advantage benefits were pulling back, and we're seeing more of the same going into 2026. We've explained this in depth on the channel, but to give you a 10,000-foot view, the reason why this is happening is in 2025, the $2,000 mandatory prescription drug cap was implemented due to the Inflation Reduction Act, which required all insurance companies that do Medicare plans, especially ones that do prescription drug plans, to cap Medicare prescription drug costs at $2,000. Well, this made them have to start paying a lot more out for claims than they ever did before related to prescription drug coverage on a wide scale. And so benefits are being pulled from other places. Some plans are being deemed as unprofitable in the method of the way they were structured. So we're seeing plans terminate at record high margins. Last open enrollment, it was over 2 million. This year open enrollment, it is about the same, over 2 million people having their Medicare Advantage plan terminated for the new plan year. And we're also seeing for plans that are staying around, not all plans, but a lot of plans are seeing benefits pull back and not be as strong as they once were. So let's get into that 5 list of things that we're seeing the most commonly. The first one that we're seeing is dental benefits, right? A lot of plans had relatively rich comprehensive dental. Not to say that all plans, like I said, are seeing a reduction in the dental benefits, but we're seeing it pretty commonly on a lot of plans across the country. Maybe there was a plan that had a lot of comprehensive benefits, and they might still have that in 2026, but they pay a lot lesser of an amount. For example, maybe there's a plan that paid $1,500 out a year towards dental claims or $2,000 out a year in dental claims, and now they're down to $1,000. We're also seeing plans that used to cover items at 100% on the comprehensive side go down to covering at 80%, or maybe they're only covering 50% of certain comprehensive items. So a reduction in dental benefits. We're also seeing certain plans that provided comprehensive dental benefits. And what I mean by comprehensive dental benefits is things like bridges, crowns, root canals, fillings, extractions, things like that. Reduce their benefit all the way down to where they eliminate the comprehensive coverage and they will only pay for things like preventative dental. So we're seeing a lot of plans take a massive step back on the dental coverage side of things across the country. And that may be your plan if you're not paying attention to that. So that's number 1. Number 2 of things we're seeing a lot of Medicare Advantage plans pull back on in 2026 is vision benefits, glasses benefits. We're seeing plans just lower their allowances. Maybe there's a plan that paid $200 or $300 a year for a pair of glasses in 2025. Now they might only pay $100 or $150 or $200, reduced amount from what they were doing before. They might also be adding more restrictions to the type of lenses that they were covering. In the past, they might have been covering things like progressive lenses, single standard lenses, bifocals, trifocals. Well, maybe they will start only covering progressive and single standard. They might not cover those other types of specialty lenses, or maybe they're adding additional copays for those specialty lenses, where in the past they might have not done so. So glasses is another area we're seeing a lot of plans pull back their benefits in 2026. Number 3, hearing, right? Dental, vision, hearing. That's kind of maybe predictable that those 3 went together, but hearing, right? A lot of plans provide hearing aid benefits, and we're seeing the amounts that they'll pay towards the hearing aids pull back, or perhaps maybe even if the plan you're on has a set copay for a hearing aid, maybe that set copay has gone up, right? Maybe they charge more than they were charging in the past for you to get a pair of hearing aids. A reduction of benefits we're seeing on a lot of plans, and the hearing aids might be more expensive on your plan in 2026 because of it. Benefit number 4 we're seeing Medicare Advantage plans pull back on broadly in 2026 is the over-the-counter item essential benefits. Now, like I said, none of these are benefits that all plans are pulling back on, but a large majority of them might be in 2026, depending on where you might be at and depending on the plan that you're on. For those of you that don't know what I'm talking about with over-the-counter item essentials, benefits have been available for many years on Medicare Advantage plans that are over-the-counter item essential allowances. Think $30 a month or $20 a month, or maybe even you have a quarterly benefit. Maybe it's $40, $50, $60, $70, $80 per quarter, meaning every 3 months, of an allowance that they will provide for you to be able to purchase things at a pharmacy, but they're over-the-counter item benefits. They're not specifically prescriptions. Things like aspirin, ibuprofen, fish oil, Band-Aids, vitamins, toothpaste, things like that, right? And these benefits on some plans are being taken away altogether to where they're just not covered anymore, or they're reducing the allowance down. So maybe they were doing, let's say, for example, $50 a quarter on your specific plan. Maybe next year they're only doing $30 a quarter, which over the course of the year, if they're doing every quarter, 4 quarters a year, would be an $80 a year reduction on the amount that they'd pay towards the over-the-counter item benefits. We're also seeing certain plans reduce the way that you can get these over-the-counter item benefits. Some plans would allow you to purchase them in a grocery store. You just go up to the pharmacy counter with a preloaded Visa, show them that, and that would pay for it. And so you're seeing certain plans reduce that. Limit the type of stores you can go to, reduce the availability of how many different stores you can go to or big retail chains. But others might be changing it entirely to where you can only get them over the internet and have them mailed to you. So we're seeing reductions in that on a lot of plans in many places in 2026. Number 5, last but not least, this is a biggie for those of you that are on special needs plans, whether that be a dual special needs plan if you have Medicaid, or whether you have a chronic special needs plan if you have a chronic medical condition. They're changing these benefits, these grocery card allowances. And make no mistake, for the vast majority of people, 99.9999999% of plans that provide these grocery card benefits, you have to either be able to get on a dual special needs plan, meaning you have Medicare and Medicaid, or you have to be able to have a chronic special needs plan, or you have to have a chronic condition, that qualifies you for a chronic special needs plan. It's not something that broadly is available to the public. Well, one thing that Medicare, the Centers for Medicare and Medicaid Services, is doing in 2026 is they're making it a rule that all plans, all insurance companies have to follow, that if you're on a dual special needs plan and maybe you have a $100, $150, $200 grocery card allowance benefit that helps pay for utilities, food, things like that, you now can still be on that plan, but in order to use that grocery card benefit in the same way, you have to now also have a qualifying chronic medical condition to be able to use it towards that. You'll still be able to use it for over-the-counter item essentials if you don't have a long-term chronic medical condition, but you will not be able to use it anymore for groceries like you did in the past. All plans that have any type of grocery card benefit, and make no mistake, it's typically always going to be a special needs plan of some kind that has additional eligibility requirements versus just your traditional Medicare plan, they now have to also require you to have a chronic medical condition to be able to use the benefit, even on a dual special needs plan. So that is a big, big change and a big reduction of benefits for a lot of people that previously might have relied on that grocery card benefit. And we think it's important that everybody is aware of it. Now, it doesn't mean that you can't use that benefit if you're on a Medicare and Medicaid plan and you do happen to have some type of long-term chronic condition. There's still a chance that you can qualify to continue to use that benefit next year, but you have to go through that process of being able to go through that process and proving that you have that long-term chronic condition. So those are 5 benefits that we're seeing get slashed by Medicare Advantage plans broadly in 2026. Like I said, my company, Everything Senior Insurance, works with people in 46 states all over the country, and we work with a myriad of different insurance companies to help you find the best fit based on your needs and preferences. We provide unbiased information, and the best part about it is our services are completely free to you. It doesn't cost you anything to be able to work with us, and we offer lifetime customer service when you have a plan with us. With us, it's a relationship with you. We care very deeply about making sure that you're covered by the best plan, but then also that the plan is working for you long term after the fact. We help answer questions. We look up information year round. We'll even get involved and help untangle a billing issue or a claim issue if you ran into one during the year, where we work with the provider and work with the insurance company to kind of get it rebuilt and straightened out. We do it all the time, every day in my office for our clients. So give us a call, 801-255-5340. Again, 801-255-5340. And we look forward to talking with you. If you found this video helpful, insightful, educational, the best way that you can help your fellow Medicare beneficiaries is by smashing the like button for the YouTube algorithm. It's going to help so many more people just like you find this information who desperately need to hear it. And until next time, thanks so much for watching all the way to the end. Happy Medicare, and everybody. We'll see you on the next one.